Good evening, everyone. Myself, Dr. Gopal Kakani from Surat. I will like to introduce myself. I am a practicing dentist in Surat since 20 years. I am a founder and a member of Be the Change group in Surat, and we are working with a new event in Surat. Introduce our today's guest, Chinu Agrawal. I will introduce her. Dr. Chinu Agrawal is a renowned psychologist in India, working in area of relationship counseling, sexual wellness, education, family counseling. She is offering India's only comprehensive training and program and certification course in relationship counseling. Her efforts in the field of psychology have been recently commended by Honorable President of India and Honorable Governor of Rajasthan. We are very privileged to have her with us.
Thank you so much. Thank you. Thank you.
So, Dr. Chinu, I will just have to have some discussion about an event we are planning in Surat. I will like to say something about the event. It is a marathon fun run type of event on 16th October Sunday at Surat. This event is organized to create an awareness for LGBT community in Surat. Well, what does psychology and research say about LGBTQ?
Yeah, thank you so much, Gopal, and many congratulations for coming up with this event, which is very, very necessary for bringing in awareness about LGBTQIA in our country. Psychology and research say that having a sexual orientation which is different than heterosexual orientation is absolutely normal. There is no evidence which says that these sexual orientations are abnormal in any way or can be termed as mental illnesses or disorders, which was thought about by many people only a few years ago. And this LGBTQ awareness in India came in very late. I think not more than 10-15 years, we have started talking openly about these things in our country. And still there is a lot of social stigma attached to this community. So it is very, very imperative for me to clarify the position of psychology, psychiatry, and mental health on LGBTQIA. That is, it is absolutely normal.
Thanks, Chinu. Thanks. Great. So why it is so challenging for LGBTQ in India?
The challenge comes from lack of acceptance in our society. So our society, not only in this area, but in all other aspects also, has been a very traditional and conservative society. We all know about that. Even for heterosexual people, sexuality is a taboo in our country. We do not talk about it. And so accepting something like this is really big, you know. Although, if you want to quote the statistics, a very recent survey conducted in 2021 tells us that at least 17% of Indians are not conforming to the identity of heterosexual. And so it is a big community, almost as if you're meeting one person out of 5 or 6 people belongs to LGBTQIA. And I'm sure these remaining 5 people do not even know the terms what is LGBTQIA.
Definitely.
You know, so the awareness is so less. The social stigma surrounding it is so high. And the acceptance is so low. That's why the community is facing so many challenges. In fact, LGBTQIA face a lot of mental health issues, and depression and anxiety is highly prevalent and common in this community.
Yeah, definitely. Right. So, as a psychologist, what do you suggest how to cope with the society or things?
See, there are 2 or 3 things that we can do about it. One is, heterosexualism, wherein the heterosexual people feel that only they are normal and others are abnormal if they are having any other sexual identity or gender identity, or they are, moving away from what is the typical norm of the society. So we have to work towards creating awareness amongst heterosexual people. हम लोग सोचते हैं कि LGBTQ के लिए काम कर रहे हैं तो हमको सिर्फ LGBTQIA को एड्रेस करना है, पर ऐसा नहीं है. You have to take the lack of awareness in the heterosexual population also into account, and you have to include them into creating this awareness and acceptance, so that a positive atmosphere for accepting the LGBTQIA community into the mainstream happens. And it doesn't offend you. It doesn't feel awkward when someone asserts his sexual orientation to you. You say that, okay, this is my orientation and this is your orientation. And since I feel that I'm normal, you are also equally normal. So, pehli baat to ye, we have to work on creating awareness. Second, for the members of the community themselves, they need to work a lot into building their own self-worth and self-esteem. Because of this social stigma, वो लोग खुद भी अपना कॉन्फिडेंस पूरा लूज कर देते हैं, डिप्रेशन में चले जाते हैं. उनको लगता है वी आर एबनॉर्मल, कहीं ना कहीं हम में कोई कमी है, या हम क्यों नॉर्मल नहीं है, या हमें कोई एक्सेप्ट क्यों नहीं करता. And there are incidences जहाँ पर they feel like taking away their lives. They do not want to work. They do not want to, mingle with the mainstream people. They are ashamed of being seen with their own community. So ये जो चीजें हैं, इसके लिए we need to work with the members of the LGBTQIA community. One is to help them accept themselves. Second is to help them identify their own distortions, their own negative emotions. If they are unhealthy, they can seek help of mental health professionals who are trained, who are QA-informed therapists. There are people who are now trained in sexuality in our country who have the qualification and certification, so they can approach them. And third, wherein they also accept that it is difficult for the heterosexual community to accept it. तो इसलिए उनके प्रति जो रोष है, उनके प्रति जो एक हॉस्टिलिटी है, उसको भी एड्रेस करना जरूरी है. जहां पर पॉजिटिव बात यह है कि हमारी सोसाइटी छोटे छोटे कदम ले रही है इस एक्सेप्टेंस और अवेयरनेस के प्रति.
Yes. So very perfect, very rightly said. And I will add just to you that this event is a marathon type where we are creating a platform where a general community and LGBT community are standing together. Yes. And general community is showing acceptance and love for LGBT. So this is a real thing that you have said, and we have created the same thing, definitely. Yeah.
Exactly. And that's why your event is class apart. It is one of its own kind. And I'm so proud that you are my childhood friend. And I would like to stand with you, my company, Feeling Minds, my team, all my students, all my colleagues stand with you with a lot of solidarity. And I'm so sorry that unfortunately I'm not being well, so I cannot come to Surat this time. But next time you will see me there in the event.
Thanks for very kind words. And thanks for being
all
there.
All the very best.
Thanks.
Thank you.